Hello future doctors, welcome to Dipenism. I am Dr. Dipen Shah, and in today's segment we are going to discuss about the external structure of heart. Now, as we are aware, human heart is four-chambered, consisting of the superior chambers, that is the atria, and the inferior chambers, that is the ventricles. So let us localize the respective chambers. So on the left side we are going to label the right structures because we are to label from the patient's perspective. So on the left side, this part is the right atrium, this part is the right ventricle, this is the left atrium, and this is the left ventricle. So these are the four chambers of the human heart. Now externally we observe presence of certain depressions, and those depressions are known as grooves or sulci. Now externally, this groove that is present, this dotted area, there is a transverse and oblique groove or sulcus which is known as the coronary sulcus. So this is the coronary sulcus. Similarly, this dotted areas is the sulcus present between the ventricles known as the interventricular sulcus. So externally we can observe two sulci distinctly, that is a coronary sulcus and a interventricular sulcus. In this sulci you observe certain structures which are branching out, and they are arising mainly from the aorta. So these structures are the arteries which are known as the coronary arteries. These coronary arteries are going to supply oxygenated blood to the heart muscles. So even the heart requires presence of oxygen so that it can perform its metabolic activities. So the oxygenated blood is supplied by the coronary arteries. In exchange, there are certain coronary veins which takes the deoxygenated blood from the heart muscles and it opens into the right atrium, and the coronary veins opens into the right atrium through an opening known as coronary sinus, but that is observed internally. But externally we observe these structures that are present. Now to mention about certain blood vessels, then the blood vessels which are opening into the right atrium, this part is the SVC, that is the superior vena cava, and this is the inferior vena cava which is going to transport deoxygenated blood and it opens into the right atrium. Similarly, in the left atrium there is opening of these two pulmonary veins coming from the left side and these two pulmonary veins coming from the right side. So there are four pulmonary veins which are bringing the blood from the lungs and opens into the left atrium. Similarly, from the right ventricle, the blood vessel that arises, that is known as the pulmonary artery, which is branching out and it is going to carry the blood towards the lungs. So this is the pulmonary artery. Similarly, from the left ventricle, the blood vessel that arises, that is the aorta. So this we have represented the aorta. So this is the ascending aorta, and from the ascending aorta we mentioned that the coronary arteries are arising. Then is the arch of the aorta, and there is a descending aorta which is going to descend down and it will pass through the thorax and the abdomen and it will branch out to produce further arteries. When we observe this arch of aorta, then the arch of aorta has presence of these structures. These are the blood vessels which are arising from the arch of the aorta. This is the presence of brachiocephalic artery. The brachiocephalic artery then branches out to form two further arteries, out of which this one is known as the right subclavian artery. The right subclavian artery is going to pass below the clavicle and will going to supply the respected areas. This is the right common carotid artery. This is the left common carotid artery, and this one is the left subclavian artery which will be passing towards the left side of the clavicle. So these two are the carotid arteries, and carotid artery is one of the largest artery present in the neck region, wherein we can feel the pulse. We can feel the pulse on the right side as well as on the left side. So this is one of the indication that the pulsation is supplying the blood to the brain and the other parts. Now a very important structure is present which connects the aortic arch and the pulmonary trunk. This structure is known as ligamentum arteriosum. This ligamentum arteriosum is actually representing a remnant this remnant is actually present in the embryonic stage as a duct, and that duct is known as ductus arteriosus of the fetus. So that ductus arteriosus, which is a patent connection between the aortic arch and the pulmonary artery, is then closed, and there is presence of ligamentum arteriosum in the adults. So that ductus arteriosus need to close after the birth of the baby. In case if this does not close, then there will be mixing of the oxygenated and the deoxygenated blood. So this we have discussed entirely about the external structure of the heart. Stay tuned for my further videos where we are going to discuss the internal structure of the heart. That's all from Dipenism.